Do you know that up to 20% of people over 60 are deficient in vitamin B12? That's right, vitamin B12 deficiency is more common than you think, and it can cause serious problems for your body and mind. Vitamin B12 or cobalamin is essential for many functions in your body, such as making red blood cells, DNA, and energy. It also helps your nervous system function properly and protects your brain from damage. Sounds pretty important, right? So, can you imagine how devastating it will be for your body if your vitamin B12 levels are low? Well, unfortunately, your body cannot make vitamin B12 on its own, so you have to get it from your diet or supplements. And that's where the problem lies. Many people don't get enough vitamin B12 from their food, either because they don't eat enough animal products or because they have trouble absorbing the vitamin from their digestive system. This can lead to vitamin B12 deficiency. This is why in this video, we will reveal to you 12 signs you have a vitamin B12 deficiency. Now, without any further ado, let's get to it. Number 1. Fatigue and weakness. Fatigue and weakness are among the earliest and most common signs of vitamin B12 deficiency. B12 is crucial for the production of red blood cells, which carry oxygen throughout the body. If there is no enough oxygen reaching your tissues, you will feel tired and weak all the time. This is because oxygen is the most important part in the chemical reactions in your body that produce energy. This type of exhaustion won't seem to go away no matter how much you sleep or rest. Approximately 80 to 90% of those with low vitamin B12 levels report experiencing constant fatigue and weakness. Number 2. Numbness or tingling. Vitamin B12 is essential for maintaining the health of nerve cells. This is because it is crucial for the maintenance and synthesis of myelin. Myelin is a fatty substance that surrounds and insulates nerve fibers. Thanks to myelin, transmission of electrical impulses between our nerve cells is rapid. However, inadequate B12 disrupts the formation of myelin. The result is slower or blocked nerve impulses. Symptoms manifest as numbness and tingling in the hands and feet, difficulty walking, balance problems, and even cognitive disturbances. Neurological symptoms are seen in 20 to 30% of vitamin B12 deficient individuals, but this can be higher in severe cases. In fact, a case study described a 45-year-old man who experienced numbness and tingling in his hands and feet, along with difficulty walking. Neurological examination and MRI scans showed signs of defective myelin. He was diagnosed with B12 deficiency-induced peripheral neuropathy. When he was treated with B12 injections, he exhibited partial recovery of his neurological functions. Number 3. Heart palpitations. Heart palpitations, or an irregular heartbeat, can be a symptom of vitamin B12 deficiency. Because of anemia, the heart has to work harder to pump oxygen-rich blood throughout the body. To achieve this, the heart must pump harder and faster. Heart palpitations are reported by around 15 to 20% of those with low levels of vitamin B12. Patients describe the sensation as if their heart is racing or pounding, especially during physical activity or when climbing stairs, as the body demands more oxygen. Number 4. Anemia. As we just stated, vitamin B12 is needed by your body to synthesize red blood cells. The lack of this crucial vitamin means that the process of red blood cells production won't go smoothly. As a result, the bone marrow produces unusually large and immature red blood cells that can't perform their function properly. This type of anemia is called megaloblastic anemia, which is Latin for large cells. It can cause symptoms such as paleness, shortness of breath, and dizziness. Anemia is present in about 50 to 60% of those with a vitamin B12 deficiency. Number 5. Cognitive impairment. Cognitive impairment, including memory loss and difficulty concentrating, can result from B12 deficiency. The reason for this is that vitamin B12 deficiency can also increase levels of homocysteine. Homocysteine is an aminosalicylate acid that is toxic to your brain cells. It can damage brain cells and blood vessels, contributing to cognitive decline. Around 20 to 25% of individuals with B12 deficiency experience cognitive symptoms. Number 6. Mood disturbances. B12 deficiency can affect mood, leading to symptoms such as depression, irritability, and anxiety. B12 is important for brain health and the synthesis of neurotransmitters like serotonin and dopamine. In case of low vitamin B12 levels, the synthesis of these chemicals is markedly reduced. These are chemicals in the brain which regulate mood, cognition, and overall brain function. This is likely due to its role in the production of neurotransmitters such as serotonin and dopamine. Mood disturbances are reported by 15 to 20% of those with a B12 deficiency. Number 7. Glossitis and mouth ulcers. Glossitis means an inflammation of the tongue. If you take a look at the tongue, you'll find it swollen, red, shiny, and smooth. This condition can cause discomfort, pain, and difficulty in eating and speaking. In addition to that, mouth ulcers are also common. These symptoms arise because B12 is essential for DNA synthesis and cell production. To clarify, this means that your old cells are removed but aren't replaced by new cells. Over time, the superficial layer of cells is eroded, producing ulcers. Adding to that, the epithelial cells lining the tongue and mouth require regular replenishment. B12 deficiency can cause these cells to become abnormally large, disrupting their normal structure and function. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 8. Breathlessness and dizziness. Breathlessness and dizziness can result from anemia due to B12 deficiency, as the body struggles to get enough oxygen to the tissues. As a compensatory mechanism, your body increases your breathing rate to get more oxygen inside it. Patients with low vitamin B12 levels experience excessive breathlessness even with mild exertion, such as walking up a flight of stairs. These symptoms are reported in approximately 20 to 25% of cases. Number 9. Vision problems. B12 deficiency can damage the optic nerve, leading to vision problems. This condition, called optic neuropathy, can cause blurred or disturbed vision. Vision problems are less common, occurring in about 5 to 10% of those with severe B12 deficiency. Number 10. Elevated homocysteine levels. Elevated levels of homocysteine, which is an amino acid, can result from B12 deficiency and increase the risk of cardiovascular diseases. Unfortunately, high homocysteine levels can damage the inner lining of arteries. This causes fats to stick to the walls and form atherosclerotic plaques. Not only that, but elevated homocysteine levels are also linked to increased blood clotting, leading to a higher risk of the blood clot obstructing the blood supply of vital organs such as lungs. B12 helps to avoid all these dreaded complications by converting homocysteine into another substance called methionine. So it keeps the levels of homocysteine in check. Elevated homocysteine levels are found in nearly 90 to 95% of individuals with a B12 deficiency. Number 11. Infertility and reproductive issues. B12 is important for reproductive health. Deficiency can lead to infertility issues in both men and women, affecting sperm production and menstrual cycles. Since vitamin B12 is crucial for DNA synthesis and cell division, the production of healthy eggs and sperm can occur without it. To give an example, a woman suffering from vitamin B12 deficiency may have eggs with chromosomal abnormalities. This reduces the chances of successful fertilization and increases the risk of miscarriage. Furthermore, if less oxygen reaches the testicles of the man due to anemia, then he will produce less sperms. Reproductive issues are reported in around 10 to 15% of individuals with a B12 deficiency. Number 12. Hair loss and skin changes. Vitamin B12 plays a role in cell reproduction and hair growth. Deficiency can lead to hair loss, brittle nails, and skin changes like hyperpigmentation, which is the abnormal darkening of areas in the skin. All these different manifestations share a common cause: which is not receiving adequate oxygen. Hair loss and skin changes are noted in 10 to 20% of cases. Patients report increased hair shedding when combing or washing their hair. This shedding can be diffuse, affecting the entire scalp, rather than localized patches. So, these were the top 12 signs you have of vitamin B12 deficiency. You can add vitamin B12 to your diet via eating fortified foods such as plant-based milk, breakfast cereals, and nutritional yeast. Or you can get the required amounts by taking vitamin B12 supplements, which are available in a variety of different forms. You can take them in the form of pills, injections, or tablets that are placed below the tongue. Now, we want to hear from you. Have you or anyone you know experienced any of these signs before? Was it due to vitamin B12 deficiency? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.